Hey everybody, back again for episode 16. But before we jump into episode 16, we want to take a little victory lap of what we predicted when the whole Ozempic craze came into light. And Dr. Whiting said that Ozempic, once the science comes out, Ozempic will be shown to trigger starvation hormones. And lo and behold, with just a little bit of science that we've had so far, you've probably seen the article, it was on all the major media news sources, that indeed Ozempic does trigger starvation hormones. So what do you think about that?
Yes, well, it never hurts to be right once in a while. But kidding aside, if it seems too good to be true, it probably is. And these so-called wonder drugs for weight loss, this is just the tip of the iceberg. The longer that people use these things, the more of these nasties side effects are going to surface. And once starvation hormones are produced, it slows your metabolism way down. So guess what's going to happen when you stop taking things like Ozempic? Your weight is going to balloon again. Because you don't have the effect of the drug, and you've now created such a sluggish metabolism through starvation hormones that you'll be lucky to eat 1,000 calories a day without gaining weight. It's terrible.
Yeah, gosh. Yeah, and so when the science comes out even more, we'll get to see if any more of your predictions are true or not, and we will continue to bring them to you here. But this one's a victory lap because you predicted it. So
hey, several months ago already.
Congratulations, digestion issues for people in their 20s and 30s. What are the biggest myths right up front about acid reflux and, the people who talk about GERD and burping up your food after you eat? You've all heard it. You've all seen the videos on YouTube, on all the other social media. What are the myths and the facts behind acid reflux?
Well, first of all, the way that medicine approaches the problem of acid reflux is almost totally 180 degrees wrong. What they do works, but it has a horrible potential for creating permanent digestive damage. First of all, acid reflux is a condition where the stomach acid begins to travel back up the esophagus and it causes burning and irritation and so forth. So most naturally, people, including most doctors, think that, well, that's excess stomach acid because it's running back up my throat. The fact of the matter is that that situation is caused by a lack of stomach acid. If you had adequate stomach acid, it wouldn't be running up your throat. It would be digesting your food quickly and moving it to the small intestine. But when you don't have enough acid, the food lays in your stomach for hours and ferments. And this causes gases, belching, burping, bloating, feelings of fullness, swelling of the upper torso, and so forth. And that is all attributed to excess stomach acid. Not true. It is a lack of stomach acid. So instead of using antacid drinks and pills and prescriptions, tablets, you should be increasing your acidic stomach and not decreasing it. And what these medications do is they destroy all the stomach acid that you possibly have. And this opens a little valve at the bottom of your stomach and dumps the contents of the stomach into the small intestine. Once that occurs, the belching, burping, bloating, feelings of fullness all instantly disappear. Wow, it's a miracle. I feel great. So that means I can continue to consume an abusive diet because now I have a secret weapon. I can take a shot of that or 2 pills of that and I can make it all go away. But the result of an alkaline stomach is increased chances for arthritis, bursitis, those types of things. You can't digest protein in an alkaline, so if you don't have an acidic stomach, you'll be protein deficient. You can't absorb minerals in an alkaline environment. You need acid. So that means you're going to be calcium deficient, magnesium deficient, trace mineral deficient, and that's going to lead to bone loss later in life. And that process can begin as early as in your late 20s and 30s.
And so it appears that antacids provide such fast relief. What's the problem with them? That is what the problem is with them, what they do, and they drop the contents of your stomach into the intestine, and that doesn't allow for digestion.
Especially of proteins, right?
Yeah, and so what's a better way? What makes up a good digestive supplement? Like, I guess probably the digestive support from Phoenix Nutritionals, but what in it does that?
Well, we approach digestive support from several different angles. First of all, it's a high acidic formula because we use hydrochloric acid. And that helps to acidify and stimulate natural gastric acids.
So it stimulates your body to help make it natural. Yeah, produce
gastric acid through the stomach wall. Then we have a series of enzymes and enzyme precursors to help further break down the food so you get the better nutrition, you get the nutrients out of it.
Absorption.
And you get absorption, and so on and so on. So a formula like that is absolutely amazing. I mean, it is one of the oldest formulas. I've recently reformulated it about a year ago. But we've been using some version of it for many, many years. And people are absolutely amazed. They suffer from all this burping and belching. We give them a half a dozen of those with a meal, and they feel wonderful. I can't believe it.
Yeah, it's just incredible. So if you think you have acid reflux, you might want to look into it because it might not be acid reflux. It could very well be a lack of acid, and you might have a lot easier way to combat such a thing. Developing arthritis in your 20s and 30s is also a big one that we've been getting asked to do on, and we've done a little bit of it. But first off, how does arthritis for people in their 20s and 30s happen so early on when it used to be something that was thought of as being something as for an older person to get?
Well, yeah, I mean, I remember 30, 40 years ago, we didn't even think about arthritis until you were 50.
Yeah.
And now all of a sudden, people are beginning to get stiff, achy joints. They're beginning to have loss of range of motion, certainly in their 30s. And I think the reason for that is lifestyle. First of all, people are nutrient deficient because the food that we consume has no nutrients of any quantity or quality.
And we talked about that in the MPK videos.
Yes, exactly. And that, if you want to scare yourself, go listen to that one. But there's more to it than that. There's environmental, there's excess stress. See, what people don't realize is that no matter what problem you have, I guarantee you stress is involved with it because it is the cardinal cause of all illness and disorder. And also an alkaline environment, which we talked about earlier, because it prevents the breakdown of protein, it prevents the absorption of minerals. And so already people in their late 20s, 30s, early 40s, we're seeing mineral depletion. We're seeing loss of cartilage tissue between the joints. And this is all diet, lifestyle, excess stress. There's so many factors involved. And the reason why we're seeing it at this age now, as opposed to 30, 40 years ago when we didn't worry about it until you were 50, is because these things are on the rise. So in other words, our food is getting worse, our stress is getting higher, we don't sleep properly, and all of these things come together. Your cartilage tissue, which is your insulation between your joints, is a protein. Well, if you're not digesting and absorbing proteins, breaking them down to amino acids, how do you think you're going to replace cartilage tissue as it wears away?
Yeah.
You're not.
So that's kind of the evolution of joint damage and arthritis, and it has a lot to do with the cartilage and all those things that you just said. What can people do in their 20s and 30s to hedge their bet against arthritis? And, you know, I guess it seems pretty easy. Try not to lead such a sedentary lifestyle. Eat better, cook at home maybe, so you're eating less processed food. Deal with stress better, maybe get a nutrient support formula to help you with stress. Maybe start taking a multivitamin that's complete. Mm-hmm. That's really the basic foundation of what you agree with, right?
Absolutely. And you know, normally we don't use joint support formulas for people in that age group, but it might not be such a bad idea.
Yeah.
One thing I would suggest is that you use a natural anti-inflammatory support, because inflammation is caused by toxic chemicals in our environment and food,
stress,
a lack of nutrients, excess stress, and the list goes on and on. And people are burning the candle at both ends at younger and younger ages. It used to be, I used to say, all you need is a full spectrum supplement. I'm slowly changing my mind on that. I think you need a full spectrum supplement and something to naturally help control the inflammatory response, because it's so universally rampant. I can't think of anyone in any situation that would be immune to excess inflammation.
Yeah. Well, like you say, like I've heard you speak all over the world to thousands and thousands of people, to large, massive conventions, that inflammation is the cardinal cause of a lot of those things.
Yep, that and stress. Well, stress is one of the biggest factors in inflammation response, so they go hand in hand.
Yeah.